This is Dr. Stephen Harkins, and welcome to page 88 of Anatomy Coloring Book. And we've already learned about the brachial plexus, or the nerves from the sacral area exiting, or the cervical area exiting the spine. Nerves that innervate the arm. Now we're going to talk in a similar way about the lumbar and sacral plexuses, which do not go to the arm, but rather they go to the lower limb, the legs. And in a similar way, the anterior rami exit from the spinal column at the indicated levels, L1, L2, L3, L4, and L5. And they will join up with their neighboring levels to form a plexus and eventually nerves that go to the lower limb. So the lumbar plexus consists of L1 to L4. And accordingly, they first form the lumbar plexus like so. So you'll see nerves. Here's the lumbar plexus right here. Let's make it low. So the nerves are going to come together forming the lumbar plexus from L1 from L2 to here, L3 and L4. And they will form this plexus right here, the lumbar plexus. Excuse me, the plexus is this, of course, this group of nerves here. This group of nerves coming together here. And they join together to form, in their first portion, the femoral nerve. And this is the femoral nerve right here. But they start out in red here as primary rami from the spinal nerve of the spinal cord, and then the plexus is in blue here, and then they form the femoral nerve, and the femoral nerve travels underneath this ligament, this ligament here called the inguinal ligament. This is called the inguinal ligament because it's in the inguinal region. And the femoral nerve will branch off into these divisions which innervate the quad muscles, the quadriceps muscles, the rectus femoris, the vastus medialis, vastus intermedius, vastus lateralis. They're the legs in the front they're the muscles in the front of your leg that straighten your leg. The big muscles in the front of your leg. But it also gives off a branch to the what's called the saphenous nerve. Right here, the saphenous nerve. And the saphenous nerve does not innervate the quadricep muscles of the front of the leg. It goes down past the knee and innervates all the way down past the ankle and even into the foot. And we'll learn more about the saphenous nerve later. The obturator nerve is this nerve here that passes through the obturator foramen. This is in your pelvis, it's a bony foramen or a hole in your pelvis, in the bottom of your pelvis. And this is the obturator nerve coming off the plexus here, off the lumbar plexus, underneath the inguinal ligament, and through that obturator foramen right there. And the obturator nerve innervates not the quadricep muscles like the femoral nerve, but the adductor muscles. Let's see, the adductor muscles of the inner thigh, the muscles that bring your leg inward. If you were to squeeze a basketball between your legs, you'd be using your adductor muscles innervated by the obturator nerve. So the saphenous nerve is in purple. Femoral nerve is in green. There you go, green. And the lumbar plexus is blue. Also branching off of the lumbar plexus is this nerve right here called the lateral femoral cutaneous nerve. And just as the name indicates, it's on the lateral part of the leg. This is the lateral part of the leg. The medial leg is over here. And the lateral femoral cutaneous nerve heads all the way to the knee, innervating the skin of the knee, cutaneous, the skin of the thigh, I should say, of the lateral thigh. And that's why it's called a cutaneous nerve. Cutaneous means skin. And this is a place, an important place, where if you let your belt go too low around your waist, it can trap this nerve and give you symptoms called neuralgia paresthetica, a numbness or a tingling on the thigh, the front of the thigh, of the skin of the thigh. Next, we have the lumbosacral trunk, which is this very short area right here. It comes from the L4 nerve, anterior rami, and the L5 anterior rami, nerves coming out the spinal cord. And notice that it joins with what is called the sacral plexus, which is this group of nerves coming out of the sacrum, from the anterior primary rami, the sacral spinal nerves. And this nerve gives off two nerves, the superior gluteal nerve. It passes through this little notch right here and goes behind, whereas the femoral nerve came out in front, was in the anterior part of the leg right here, right? And the lateral femoral cutaneous were the front and the side of the leg. The nerves from the sacral plexus head back behind and gives off first these two branches, the superior gluteal nerve and then the inferior gluteal nerve. The inferior gluteal nerve, right here. And what these nerves do is they innervate the gluteal muscles. So up here to the, where is it, right? Yeah, the superior gluteal nerve innervates the, goes above the piriformis muscle and innervates the gluteus medius, and the inferior innervates the gluteus maximus. So here's the inferior gluteal nerve. Obviously, it's below, and then the superior in green. And this is a little notch right here. It's a little area. That's a little hole in the bone that these nerves can pass through. So it's called the greater sciatic notch. And if I could just kind of erase right here, you'll see the greater sciatic notch right in through here. It's this sort of hole created right here that it's this gap area right here that these nerves travel through and behind. And to repeat, the superior gluteal nerve in green innervates the gluteus medius muscle, the inferior gluteal nerve innervates the gluteus maximus. The medius in green, the maximus in purple. And to once again highlight the greater sciatic notch, this area of bone right here that the nerve is able to travel through. The most notable item coming off of the sacral plexus is the very popular sciatic nerve. Big, thick nerve heading out the back behind. So this is the posterior, and this is the anterior. And coming off a big, thick nerve coming off out the back. And of course, you've heard of this because when people have back pain, the sciatic nerve is notorious. It is the notorious gangster, if you will, that is the criminal that is ruining people's backs or giving them so many problems and so much pain. And so it's this nerve coming. Here's the plexus here. And we have the superior and inferior. And then we have the gluteal nerves. And then we have the sciatic heading straight down the back of the leg. And dividing into these two branches here. Tibial nerve and the common fibular nerve, also known as the common peroneal nerve. And then it wraps around the common fibular or common peroneal, wraps around the front after traveling down the back of the leg and divides into its two branches, the superficial fibular and the deep fibular nerve. Now let's go through that. Before we do, observe how the tibial nerve branches off to the medial tibial plantar nerve, plantar meaning the bottom of the foot, and the lateral plantar nerve, meaning the side of the bottom of the foot, the outside. So here we have the sciatic nerve. We've already discussed the superior gluteal, the inferior gluteal, and the posterior. We have not discussed the posterior femoral cutaneous nerve. The posterior femoral cutaneous nerve is this nerve right here, coming off the sacral plexus, not coming off the sciatic nerve, but off of the sacral plexus. So we had the superior gluteal, the inferior gluteal. Now we have the posterior femoral cutaneous, which provides, innervates the skin. Obviously, it's a skin. Cutaneous means skin. And it provides sensation to the skin or innervation to the skin of the back of the thigh and leg, as well as the peroneal area, which is the area between your legs. So the back of the thigh, the skin, and the peroneal area. That's the posterior femoral cutaneous nerve. Now, back to the sciatic nerve. Along its route, it gives off branches to the hamstring muscles. Just as the femoral nerve in the front gave branches to the quadriceps muscles on the anterior thigh, and just as the obturator nerve supplied to the muscles of the inside of the thigh, it is the branches of the sciatic nerve that supply the muscles of the hamstrings, the back of the thigh. And as I stated, it splits into the tibial nerve medially and the common peroneal or common fibular nerve laterally. And this nerve does not continue down the back of the leg. It wraps around the front. You can see here the common peroneal nerve. And then it splits into two separate nerves. Let's talk about that. Let's talk about in green the tibial nerve. The tibial nerve supplies the posterior leg muscles. So that's going to be your calf muscles. And the muscles at the bottom of the foot. So the muscles you use, this is the back. Remember, this is your posterior. So the toes pointed down. This is the plantar surface of the foot. So if you were to grasp something with your toes, you would do it with the muscles at the bottom of your foot, innervated by the tibial nerve. If you were to stand on your toes, you would do it with muscles from the tibial, supplied by the tibial nerve. There would be the calf muscles, the gastroc muscles. A ballet dancer who goes on point would very much rely on the tibial nerve, a branch of the sciatic nerve. Now let's talk about this common peroneal nerve that comes off of the sciatic here in blue, wraps around the fibula, also known as the common fibular nerve, and then has two branches, the superficial fibular in light blue here, and the deep fibular or deep peroneal nerve. Deep fibular or deep or peroneal nerve. The superficial, peroneal or fibular. Now, the superficial fibular nerve, along with the deep, supply the muscles not of the back of the leg, but the muscles on the front of the leg. If you were to walk on your heels and lift your toes up, walk on your heels, these muscles on the front of the leg would activate and fire up. They, and the side of the leg as well, the muscles on the side of your lower leg. Those muscles are innervated by the superficial and deep fibular nerves, which came from what? The common peroneal, which wrapped around the fibula and branched off from the sciatic nerve, along with the tibial nerve. Another nerve that came off the sacral plexus, a very small nerve, came off right here at the lower sacral plexus here and formed what's called the pudendal nerve. And you can see it coming, a very tiny little nerve wrapping around right here through the greatest sciatic notch. And it supplies the muscles of the perineum, those muscles between your legs. So this concludes our lesson, page 88 of Anatomy Coloring Book. I'm Dr. Stephen Harkins. Until next time.